Hello, my name is Faith Boyson and I'm a student nurse at HAC, and today I'm going to be demonstrating personal hygiene. So, here I go. Knock, knock, knock. Hello, my name is Faith Boyson. I'm a student nurse at HAC. I'm washing my hands. Could you please state your name and date of birth?
Sit girl.
Thank you. I'm going to pull the privacy curtain. And today, Susie Q, I'm going to be helping you get on and off the bedpan and helping you wash your hands and your face and helping you with oral care. Okay? Do you have any allergies?
Not that I can think of.
Okay. So I'm going to put on my gloves. All right. I'm going to make sure the cowbell isn't in the way, and I'm going to raise the bed to a proper working height. Make sure the wheels are locked so it doesn't roll around when she's rolling. So can I take this blanket down? All right, I'm going to have you roll towards the wall. Very nice. Okay, now you can come back. There. You like, okay, you can, and you feel pretty nice on it? Centered? Okay, now I'm going to give her some privacy, raise the head of her bed, put the bed back in the low position, and go out. Okay, now she's finished, so I'm going to come back in again and tell her who I am and all that. And I'm going to put on clean gloves again. All right, you can roll back carefully. Yep, roll back. Very nice. Now I'm going to clean her and have her roll back. I put the bedpan down at the bottom of the bed on a towel so it wouldn't touch the clean sheets. Now I'm going to take care of everything and wash my hands, and next I'm going to help her wash her hands. Okay. So I've washed my hands and I've put on clean gloves. And right here I have a basin of hot soapy water, or like warm, not too hot. It's like about 105 degrees, 100 to 105 degrees of hot soapy water, and I have a basin of rinse water with wash rags in them. So first I'm going to give her a soapy wash rag. Oh, by the way, my bed is raised to a proper working height. Okay, you may wash your hands. I'm going to drop it in the laundry. I'm going to give her a rinser. You may rinse them. Drop it in the laundry. Okay, now you may dry them. Okay. All right, so now I'm going to help her wash her face. So, starting with a rag with no soap, I'm going to carefully wash her eyes, starting from the inner canthus to the outer canthus. Then I'm going to get a clean surface and wash the other eye from the inner canthus to the outer canthus. Then I'm going to use a rag with some gentle cleanser and wash the rest of her face. So I'm going to do this side of her face. I'm going to do this side of her face. I'm going to do her nose and her mouth. And then I'm going to do behind her neck and her back. Does that feel okay? Does that feel better? And then I'm going to rinse it out. right, now we can dry your face. Does that feel good? You like that? Okay. Next, I'm going to help my patient brush her teeth. So right here, I have the Yankauer suction ready. And I have it set to 90 mmHg, millimeters of mercury, and I've tested it and it's working. So I'm going to position my patient. Can you come? Like, I'm going to position her in a sideline position. Okay, can you roll on your side a little more? Okay. All right, and I'm going to make her head so that it's raised a bit and it's tilted forward so that the secretions will run out. I'm going to place a towel underneath her mouth and chin so it will catch anything. And I'm also going to have a little basin here, an emesis basin. All right, so first of all, I'm going to use the tongue depressor and I'm going to check the oral mucosa for any soreness, redness, lesions, anything abnormal. And then I'm going to put some toothpaste on my toothbrush, enough to just cover the top of the bristles, and I'm going to carefully brush all surfaces of her teeth. The sides and the front and the back and the bottom, all the surfaces. And I'm also going to brush her tongue a little bit and her gums. And then I'm going to have a sponge that's dipped in, that's moistened, and I'm going to carefully rinse out her mouth with it. And then I'm going to take the Yankauer suction and suction any of the fluids that have not run out. I'm going to be careful not to get any of the mucosa sucked up in the suction. And then I'm going to take a wash rag and wash her mouth. Last of all, before I leave the room, I am going to make sure that the bed is in low position, that she has her cowbell, and if directed in the care plan, I am going to make sure that side rails are raised. All right. I'm going to wash my hands and everything. Okay, you may be excused. Okay, so now I'm going to talk a little bit about how I would wash the female and male perineal parts. So to wash the female, I would put on gloves, and I would be very careful to always wash from front to back, from the clitoris to the anus, and I would wash from the cleanest to the dirtiest, from the labia majora to the labia minora, and then last the urinary meatus. And then I would do the same with the back. I would wash the thighs first, the cleanest areas first, and then wash the anus last. Always going from front to back. And for the male, I would start with the penis, and I would gently, if he's uncircumcised, I would pull back the foreskin and make sure there's no smegma, and I would wash in a circular. After washing under the foreskin, I would put the foreskin back, and then wash down the penis and wash the scrotal area, the scrotum, and I was going from front to back and from clean to dirty. So then I would do the same with the buttocks, washing the thighs first and then washing the anus. So that's what I would do to perform correct perineal care on my patients.